Okay, today we are talking about Advantage plans for next year. Um, I broke this into three parts. So during the first part, I'm going to go through how prescription plans are structured. If you joined me in the prescription plan webinar, it's going to be the same first part that you saw there, um, just so you understand exactly how that works. Then we're going to take a quick question break. Part two, I'm going to talk about some changes I've seen for the Advantage plans for 2026 and talk about some very specific plans, a couple of the most common ones that you guys are currently on, and some plans that have popped up on my radar for next year. We'll take a final question break, and then I'm going to walk you through how you can submit your review for your request, which the email will be sent tomorrow for you guys to do that. So let's jump in and start. Okay, so this section is just about the prescription portion of your Advantage plan. So you go through three different coverage phases in your Advantage plan. The first phase is the deductible. So some plans have a deductible, some plans don't have a deductible, just depends on the plan. The plan deductible maximum for 2025 was $590. In 2026, it's $615. Typically, especially on Advantage plans, the deductible doesn't apply to tiers 1 and 2 prescriptions, which we'll talk a little bit about the tiers here in just a minute. Once you've hit your deductible, then you go into the initial coverage phase. In the initial coverage phase, that's where you pay copays or co-insurance for your prescriptions. If you have expensive prescriptions and you reach the maximum out of pocket, which is $2,100 in 2026, it was $2,000 this year, then you go into catastrophic phase, and the catastrophic phase, you pay zero for your prescriptions. And remember, prescription copays do not count towards your maximum out of pocket on your Advantage plan. That is a separate maximum out of pocket. Real quick, let's just make sure that you understand the difference between a copay and coinsurance. So a copay is a fixed dollar amount, and you'll see these not only in your prescription coverage, but also in your Advantage plan coverage. You know, when you go to a specialist and it says your copay is $40. If you see coinsurance, then you're paying a percentage. So an example of that would be if you have an $800 prescription, if the copay is $20, you just pay $20 for that prescription. If it's a 20% coinsurance, then you pay 20% of the prescription cost. So you would pay $160 for that. This is what the tiers look like for your prescriptions. So your typical generics are tier 1 and tier 2, and those just have a copay. Once you get into tier 3, then you start paying a co-insurance. And so depending upon what tier your prescription falls on, that will determine what percentage that co-insurance is. The Inflation Reduction Act started last year. Um, the point of it was to reduce prescription costs for people and the government and put more responsibility on the plans and the companies themselves. So that's kind of where this maximum $2,100 came from. You will never spend more than that on your prescriptions. But of course, then the plans are losing a lot of money. So we're seeing a lot of fallback on that. This is leading to plans dropping out of certain states or areas. It's leading to higher deductibles, higher maximum out of pockets, the use of more co-insurance instead of co-pays. We're also seeing a reduction in a lot of the extra benefits that you guys like about your Advantage plans. I want to talk a little bit about how Troop works. So this is true out of pocket, and this again refers to your prescription portion. So that initial coverage phase where your costs can add up to $2,100 includes how much you've paid in deductible. It also covers or includes your copays and co-insurance that you've paid for your prescriptions. And then it also includes the manufacturer's discount that the company is getting for those prescriptions as well. So sometimes you'll see when I quote your prescriptions, you'll reach that catastrophic phase where your prescriptions become $0 and you haven't spent that $2,100 out of your pocket yet. And that is because this manufacturer discount is also factored into that. And we don't really see that number when we look at the quote. And there's really no way to see that number except for giving me your prescriptions and looking at, what you're going to be spending each month, where the breakdown is, and then seeing where it stops. As part of the Inflation Reduction Act, these list of prescriptions are being negotiated cheaper. I haven't seen exactly what that pricing is, but I know a lot of you take these prescriptions, and hopefully we'll see a vast reduction in price on these particular prescriptions. The Medicare prescription payment plan started last year. This is available to everyone. If you are finding that you have a very large deductible and you have a very expensive January with copays, you have the option of spreading your costs evenly throughout 12 months. So what you would do is contact your plan, tell them you would like to use the Medicare prescription payment plan. They will even out your costs and bill you directly from the company, and you will no longer pay copays to the pharmacy themselves. Okay, we're going to stop here for a moment and see if there's any questions I need to address. Not so far? Okay. Then we'll continue on. Okay, 2026 Advantage plans. I'm seeing some big changes. We went from 55 plans to 49 plans next year. IU Health completely left Indiana. I know a lot of you, we've discussed IU Health in the past, and I know some of you may have friends on IU Health. So if they're looking for an agent, I am happy to advise. Jason is as well. Um, we have a few companies that have stayed in the market, but they have just removed some of their plans from the market as well. Aetna being one of them. I know a few of you are on some Aetna plans that have left the market, so we'll definitely need to replace that this year. Humana took a couple off the market. WellCare, Communicare almost completely left the market. We weren't using them anyway because they're kind of a new company. We have a new company that's entered the market, Devoted, which they have two plans. I don't like to use brand new companies. I like to kind of see where they are. So I probably won't talk about those much. I did look at the plan. I didn't think it was anything special. We also have two new specialty market companies that came in, and that's Provider Partners and American Health. And they do only I-SNP plans. An I-SNP plan is for people that are in an institution, such as a nursing home. So they really focus on a particular nursing home and providing care for those people. We have seen, because of the Inflation Reduction Act, we've seen a big reduction in the extra benefits across the board. Over the counters have been going away. I've seen a reduction in dental. The flex cards are almost gone completely. It's just the companies are cutting back on what they are providing for free. This chart here shows you a breakdown of the company and how many plans they have. I just want to quickly review what these different plan types are. So an HMO, which is usually what I recommend to our clients, you have to stay within a network of doctors. If you go out of network, there's no coverage unless it's an emergency. Emergency is always considered in network. The reason I typically recommend an HMO to my clients is because you're going to get more of those extra benefits on those plans, the dental, the vision, the silver sneakers, all that stuff are stronger in the HMOs typically, and usually your maximum out of pockets are lower. Also, the networks of doctors and hospitals are so big in Indianapolis and surrounding areas that it's not hard to stay within a network of doctors. There are some PPO options out there, and I'll touch on a couple of those later, but PPO gives you an out-of-network option as well. But again, typically the out-of-network option has a higher maximum out-of-pocket, and instead of talking co-pays for services, you're talking co-insurance. So you're paying a percentage of your doctor or hospital bill instead of just a copay. The give back plans were somewhat new last year. They are great for people that want to minimize the amount of money coming out of their monthly budget. So the way a give back plan works is they will reimburse you a portion of your Part B premium every year or every month. So I've heard that Part B next year is going to be $206.50. So the give back will have a stated amount that says we're going to give back $100 of that into your Social Security check each month. So we'll talk a little bit about one of those plans in a bit, but that those plans, they have high maximum out of pockets, they have higher copays, and they have less extra benefits. So that's for a person that wants to just maximize their monthly budget and doesn't go to the doctor much. And we usually recommend subsidizing that with an indemnity product as well. There are several specialty plans out there. There are 11 C-SNPs. C-SNPs are for chronic conditions. There are plans for people with kidney failure. There are plans for diabetics and heart issues. So a lot of diabetics and a lot of people have heart issues or are diabetic. You could look at one of those plans. I'm happy to talk about those plans with you, but I've looked at them and I'm not seeing better benefits on those plans. I would say the only time those would come into play is if your medications were substantially cheaper on those plans, and then it would warrant using those instead of a regular HMO or PPO. The D-SNP plans are for people that qualify for both Medicaid and Medicare. And again, Medicaid, you have to be financially qualified for. So if you have both of those, these plans are great because they coordinate very well with Medicare and Medicaid. Again, the I-SNPs I touched on a minute ago, those are people that are institutionalized in like a nursing home facility. And the last one is a VA plan. So for my veterans out there, if you get a lot of your treatment at the VA hospital or fill your prescriptions there, there are some fantastic VA plans out there for veterans that provide tons of extra benefits. They all have a give back for the Part B. So if you fall into that category, that's definitely something that we can discuss. Top plans for 2025. So most of you have been on one of these three plans that I'm going to talk about. So I wanted to just kind of compare and contrast these three because most of you are in one of these three plans already. So Humana Gold, still looking like a great plan. They actually reduced their maximum out of pocket for 2026. It's going from 4,500 down to 4,250. I saw copays, there's very little change. I saw some were going up about $5, some went down about $5, but I didn't see any huge jumps there. The hearing benefit is the same. The dental benefit is the same, and it does include the major restorative still. The vision actually went up from $200 up to $450. They did get rid of the spending card. So if you have a spending card now, spend it because it will no longer be good at the end of the year. They did keep their over-the-counter $75 per quarter, and they still have silver sneakers. So this is still a very strong plan. If you've in this plan and you've liked this plan, I'm not probably going to find something you're going to like better. Another popular plan that you guys are on is the United Healthcare Essentials HMO. They did increase some of their copays. The max amount of pocket is going from 3,700 up to 3,900. The copay increases I looked at, I was seeing $50 jumps in some of those categories, like hospital, I think it was emergency room. So I saw a little bit of a jump there. The hearing coverage is the same. The dental is preventative, just like it was last year. This year or next year, you can add an additional dental rider if you want additional dental coverage. We need to look at that if that's something you want to consider because there might actually be an outside dental plan that's better than their rider. Vision, the same, up to $300. no spending card, but they didn't have one this year. They did get rid of their over-the-counter stipend, so no over-the-counter stipend, and they still have their silver and fit. So again, this is still a great plan. Just note there's some increases, but I would say United Healthcare probably has the biggest network of doctors out of anybody. So if that's your concern, then this is a great plan. And maximum out of pocket is quite low. Last one I'm going to compare and contrast is the Anthem HMO. A lot of you have. Maximum out of pocket is going down a little bit. Just like the Humana plan, the copays, I saw some very small changes there, $5 here, $10 here, up or down. So not a huge difference. They did reduce their hearing aid coverage from 3,000 down to 2,000, but they increased their dental. So dental's going from 1,500 up to 3,000. Vision is the same. They are getting rid of the flex card. They are getting rid of those extra essentials. So if you're on this plan and you had picked, a grocery benefit or extra dental vision hearing, that's going away next year. Over the counter has been greatly reduced from 110 a quarter down to $35 a quarter. And the biggest shock to me is they're getting rid of silver sneakers next year. So Anthem, no more silver sneakers on their Advantage plan. I'm going to pause there for a second. Is there anything I need to address on that, Jason? Okay. So next, I'm going to go into some other plans that are kind of standing out for me next year. Now, just know that just because I'm talking about these plans doesn't mean there's some other plans that might be better for your specific situation. These are ones that I'm purely looking at a copay, maximum, and extra benefits standpoint. I'm not taking into consideration your prescriptions, which may push us in one direction or another or away, or even your doctor's list. So you may have some doctors that are only in a certain network and not in another network. So those are all factors that are obviously not taken into consideration right now. This is purely from a what's in the plan standpoint. If you're going to go PPO, this is probably my favorite one next year. This is called Humana Full Access PPO. I like it because the maximum out of pocket is only $6,700, and that is combined for in and out of network. So once you hit 6,700, you have hit your maximum. A lot of the other PPO maximum out of pockets are $10,000 or above. So there is a small medical deductible on this one. So you do have to pay the first, excuse me, $215 out of pocket first. And there are some exclusions to that deductible. Certain things the medical deductible doesn't apply to, but it's just something to be aware of. Preventative dental is included in this plan, not major restorative. There is still hearing coverage, and they give you a small amount, $100 vision. So you can see how the PPOs definitely tailored down those extra benefits. But this one still has it, and I like the max amount of pocket being so low. The next two plans I'm going to talk about are WellCare plans. I have always been a little leery of WellCare as far as they don't have the best reputation for customer service. So, and that is still a concern to me. So I want to talk about these plans because their extra benefits really stand out compared to what's being offered. But I say it with a caveat that I don't have a lot of clients on the WellCare plans, but I feel like the service is not necessarily up as high as I would like to see with some of the other companies such as Humana, United Healthcare, and Anthem. So that being said, this is a fabulous looking plan. It is a PPO. The max amount of pocket is $4,300 for in-network and then $8,950 out of network. It has $5,000 worth of dental coverage with major restorative included. It has hearing, vision, and then they give a $65 per month over-the-counter stipend. And that over-the-counter stipend can be used towards dental, vision, hearing as well. And anything unused rolls over to the next month. It does end at the end of the year, but it can roll over month to month. So it's a pretty good benefit. This is another WellCare PPO. Maximum out of pocket's a little bit higher, but the crazy thing about this one is it has unlimited dental. So they are putting no limit on the dental and it includes major restorative. So I've never seen a plan like that before. And they offer the $54 per month over the counter with the, you can also use for dental, vision, hearing, and it rolls over just like that other plan. So again, these plans look great, but I say it with a caveat because WellCare is not my favorite company. I wanted to give one example of a give back plan. I think the strongest give back plan offered is the Humana give back plan. It is a PPO. Maximum out of pocket in network is 9,150. Out of network is 13,900. So you can see those maximum out of pockets are much higher, but you do get $123 of your Part B back. So if you're paying $206.50 in Part B premium minus your $123 give back, you're only spending now $83.50 a month for your Part B. So this is for people that are trying to keep that budget tight. It's a really good idea to take a portion of that savings and put it into an indemnity plan that will help offset some of those potential copays and that max amount of pocket, make that a little bit easier. So that's also a strategy that I'm happy to talk about with you guys. It has a little bit of dental, $500 of preventative dental. I guess that would get you a couple cleanings and x-rays for the year. Your hearing is also included and you get $100 of vision. Questions? Got anything, Jace? All right. All right, so for the last section, I'm just going to show you quickly what the email tomorrow will take you to and how to submit your review request to me tomorrow. So there will be my link didn't work earlier. Let me try again. Okay, here we go. All right, so when you click on the link that I will send you in an email tomorrow, it will take you to this page. And you'll click Start Medicare Guide. You will type your name and your last name. Of course, if there's a star, it's required. If there's not, you can leave it off. Your birthday and your email. Phone number is not required. You can leave that off. And you click Continue. On the address screen, only need your zip code. Save and continue. For those of you that are on Advantage plans, you do need to fill out your doctors. So you'll just type the last name of your doctor. Let's go with Smith. And it will bring a whole list of people that you can scroll through to find your doctor. And you'll click it and it will add. And you can continue to add your doctors on there. If for some reason you can't find someone in there, just leave them off and send me an email and say, I need to add this doctor, and I'll put that on your list separately. So once you have all your doctors in here, you save and continue. Here's where you need to enter your medications. This part is very important. I need you to make sure that if you are taking a generic for something, that you put your generic in here and not the name brand. I need you to double check your dosage amount and also whether you're taking a capsule or a tablet. That can actually make a really big difference. I'm going to show you what I mean by that. Levothyroxine is the most popular one that people mess up. If I can find it. So, there it is. So levothyroxine, select. So in this dropdown, you'll see CAP stands for capsule. Most of you are taking a tablet. So the tablet is a tier 1, the capsule is a tier 4. So you can see how just selecting the wrong thing between a capsule and a tablet can make a huge difference in the quote that I provide to you. How often you're filling it. So if you pick up a 90-day supply, you would pick 3 months and that you pick up 90 and then you save the medication. You'll keep repeating this process until you get all of your prescriptions in there. If you're taking something as needed, then just make a guess as to how often you fill it because as needed is not a choice. Once you have them all in, save and continue. If you like mail order, you can select mail order. If you use a physical pharmacy, then you can just start typing that in and select it and save and continue. This last portion is to fill out the scope of appointment form. This is a government required form that we have to have on file. This is important to fill out correctly because it tells me what you are wanting me to quote. So if you are on an Advantage plan and you know you're staying on an Advantage plan next year, please just select the Advantage plan. Some people last year were selecting all of the boxes, and that tells me that we have to have a bigger conversation. So you get put in sort of a different pile of reviews. If you want to talk about indemnity plans that you compare with your Advantage plans to help offset some of those copays, you can select that here. If you are thinking about going to traditional Medicare, then of course, please do select the standalone prescription plan. If you want to know what any of these mean, you can click this button here and it will show you or tell you what they are. And when you're done picking, down here it says, I am signing for myself. That will apply to most of you, unless you have POA over someone. So if you're completing a quote for a spouse or a parent or a sibling, then you would select that you are signing as an authorized representative for that person. But most of you are doing this for yourself. So I am signing for myself, and then you type your first and last name, sign and complete, and that's it. So this now sends to me, and I add you to my list, and I work down my list as quickly as I can. So the first thing you'll get from me is an email when I'm ready to do your review. And the email will say, this is based on what you sent me. This is what I think. At that point, we can schedule a phone call or a Zoom call and discuss further. We can continue through email or we can set an appointment. But those appointments can't be set until you get that first review email from me because I'm not ready to look at your stuff until I've sent that email. So I hope that clarifies everything. I'm going to talk briefly about what's coming next. If I can get my screen to change. There we go. Okay, so again, I'll send the email link tomorrow for you to start completing to submit to us to do a review. If you decide you like your plan and you want to keep it, it will automatically renew for next year. So you don't have to do anything. We will accept review submissions until Thanksgiving. And the last day we can make a change is December 7th. For people that are on an Advantage plan, there's an additional window when you can make a change. So it's called open enrollment period. It runs from January 1st until March 31st. Agents are not allowed to advertise that that exists. But if you are on a plan and you don't like it, or you didn't switch and now you decide you want to, you have one more chance to make a switch between that first quarter of next year. And that is all I have for you guys today. If there's any other questions, I'm happy to stay on here and go through your questions. Otherwise, you're welcome to go. It's so nice to see so many familiar names here, and I look forward to talking to you this year.